here is something about humanistic therapy, which is a little bit different from existential. Okay. Now, for humanistic psychology, the focus on what? The search of true self. Remember your first lecture, I asked you a question, what's your true self? Remember? Eh? Do you remember what is your true self? Do you want to answer that question, what's your true self?
Still evolving.
Huh?
Still evolving.
So you're evolving self.
I mean, everybody need to have some sense of your true self. I mean, your true self may be evolving, might be faulty, but you know, it's human nature to say, well, who am I? What am I? So that you must have some kind of concept of what you're made of, you know, what represents the real you. Okay. And what would be the existential approach different from humanistic? The existential approach, we're more interested in your quest for meaning rather than the quest for self, human self, as some kind of entity, right? It's more interested in your quest for meaning, right? What are the main contributions? You know, if a therapist, in what way you help you to, you know, to use the humanistic perspective? That's quite obvious, right? You will have a much noble and high view of your client and believe in their autonomy, their innate goodness, and their dignity. And also you're confident in their ability of self-healing. We talked about it earlier. Okay? And finally, that is the common factor. The main contribution of humanistic psychology says that if you are able to provide a nurturing, a safe, and trusting environment, then what? If you do the first part, then what? Complete sentence for me. If you are able to create such an environment, then your client will what? Huh?
Heal themselves.
Yeah, exactly. Right? Roger will say, oh, right or wrong, it doesn't matter, but he is saying that if you give that environment, most people, I don't think 100% of people, most people will be able to make the right decision and to understand their problem and to do what is right and to heal themselves. So the reason why we have so many people with mental disorder, with problems, is because our society is no longer able to provide that, right? Family is supposed to be a safe haven, supposed to provide such an environment, but often it's not the case. School, church, everywhere you go, it's a human problem, it's a conflict. So where can you find that? In your therapy room. That's the sad part, right? That's why they pay money to see you, because you're the only person in the whole wide world is able to provide that. Can you do that? If you can do that, you'll be able to attract many clients to come to you, right? But it's the only place on earth that you can experience that. Okay, now here is another challenge. Roger says that a therapist needs to be genuine. Okay, authentic. Okay. What does that mean? A genuine therapist is free to be himself in a deep, authentic way without any facade. Okay. Could a therapist be angry and mad with the client? Eh?
Yes.
Sure. Why? In what situation? Eh? Sometimes I got so frustrated with my client, I scream at them. And they will say, "Oh, I'm sorry, you got so upset with me. They know they caused me upset. It's not my fault." Sometimes, yeah, don't laugh, that's true. I scream at them and say,
that is seen as you needing therapy.
"What's that?"
You're being abusive.
Yes, or being abusive, right?
No, you see, but depends how you get angry. Okay?
In some.
You're angry for them keep hurting themselves. I say, you don't have to, right? You're frustrated with their insistence on the only way is a destructive way. But there's a better way. I'm angry now, right? I say, there's a much better way. You don't have to engage in self-destruction. You don't have to. See, what I convey, that kind of I care, right? But sometimes I could become irritated and angry because my own personal demon, right? Possible, right? To be genuine means that I acknowledge that I'm a personal demon. And when they come out and get me, I'm so sorry, I lose my cool, I lose my temper. I apologize, right? I'm not perfect, so there are no perfect human beings in the world. You pretend to be perfect, I'll be inauthentic, right? I'll be how do you call that? Not genuine, right? So I could be angry, I could be upset because I flip. I'm very sorry, I'm sorry, it's not your fault. I apologize. So that teach the kind of what?
Forgiveness.
Forgiveness. And it's all right to fail sometimes, right?
It's the human experience.
Right? It's all right. You don't need to pretend to be good all the time. Now, Teresa has lived with us for a few days now, right? I'm not perfect, right?
Yes.
Thank you. My wife lived with long time, 50 years. I'm not perfect, right?
Say yes.
Come on, I'm not answering. Of course not, right? She should answer. She's too kind, too kind. I mean, nobody's perfect. That nobody is perfectly beautiful, right? Unless you do plastic surgery, right? Nobody is perfectly beautiful personality-wise. I mean, that's what we are, right? And also, a genuine person is a high degree of integration. In other words, you integrate, the good part with the bad part, and so you're, like in psychology, we talk about compartment. How to pronounce that? Compartmentalization, or fragmentation, or worse, disintegration. They're all horrible words, right? But what happens when people are fragmented? When people are compartmentalized? So that will create a problem in terms of sometimes you don't know which part of you, right, is real, which parts are not real. So you are not in communication with yourself because you are divided. You have a divided self. So part of the things for the therapist to do, part of the work you guys have to figure out the other self. Am I a divided self? Am I a fragmented self? Or am I an integrated self? You remember Carl Jung? What is the ultimate aim of individuation? What the ultimate aim is integration, right? Integrate the male part with the female part, the dark part with the bright part, right? It's integration, right? Okay, theme of existential therapy now, okay? If humanistic psychologist is concerned about helping the client to find himself or herself, the existential therapist is more interested in encourage the client to find meaning for his life or for the situation. Okay? Do you see any conflict between two positions? Between humanistic and existential? One emphasizes finding your true self. The other one is finding your meaning for existence, the meaning for your situation. Do you see any conflict? No, right? So my approach is called meaning-centered, which is basically is person-centered with the focus on meaning. So I combine the two. Royal May also integrated the two. So there isn't much difference except the emphasis. The main difference is that existential therapy recognize and confront the dark side, whereas humanistic psychologists tend to overlook the dark side. The same problem with positive psychology, they tend to leave out the evil part. Now, when we talk about the dark side, what are we talking about? What's your understanding of the dark side?
Young might call the shadow.
Huh?
It could be the shadow. Like, I mean.
So what is a shadow?
Well,
Carl Jung's idea of shadow?
yeah, well, it's all, yeah, I type of it. Let's say I might have a procrastination tendency. On the other side of that shadow of my procrastinated tendency, I could use it to nurture my patience. So if I, like the.
Well, I'm not talking about transformation. I know.
Okay.
What's your understanding of a shadow? Do you have a shadow? Do you have a dark side?
Yeah, nasty.
Do you want to confess your dark side? Have you ever confessed your dark side to your client?
Yes.
Yeah? Sure,
Not
right?
all of it, no.
A little bit, but not too much, right? Not too much. We're all human. We all have a. So usually, so finally, the positive psychologists, the guys, the positive psychology has the same problem as humanistic. They tend to leave out the dark part, the dark side. Finally, they began to recognize, oh, we should talk about the upside of the dark side. Okay, Todd already spoke on that. It sounds quite well. But Todd still have a very superficial understanding of the dark side. To them, the dark side means the negative emotion. Okay, that's a negative emotion can be put to good use, right? What is the upside of your anger?
Well, but it's okay that you have those feelings and that you can't, well, and when you're doing it with a client, sometimes what you're doing is you're regulating that emotion. And so you're helping them to understand that they could probably do that too.
Yeah. So anger is, I'm angry with my client sometimes, right? a lot of time, otherwise I was scared away, right? So anger is your reaction to some problem that should not be there, right? Your anger to the treatment you have received, which is unjust. So they often, anger is the motivation to make changes, right? I'm sick and tired of being me. Okay, change yourself. Okay? You're sick and tired of me, you better do something about it. I'm sick and tired of being lost. Okay? That's fine, you're lost, fine, that's not pleasant. But if you are interested, you're serious about yourself, you will find a way eventually. Don't cry, oh, I'm lost, I'm lost. Lost, that is fine. But don't stay there. Because don't feel sorry for yourself, you're lost. Get up your ass and move. I like you moving. You will find your way. So, anger, they all have sadness, also is good, right? So, but